Okay, good morning, everyone. I'm Dr. Charles Benight, the Executive Director of the Lyda Hill Institute for Human Resilience. And as we get going this morning, we'll have a few more minutes for people to get logged in. But I wanted to thank you all who are signing in right now for taking an hour of your morning to hear about what we have been doing over the last year. I'm very excited to tell you all of the different activities we've been working on so strongly and so intensely for the last year, but also for the last several years since we launched the Institute in 2020. I have a panel group today to help present. I want to mention their names and then they'll be coming on at different points in the presentation. Dr. Heather Littleton, who's our Director of Research Operations, will be talking about our background in research and what we've been doing. Nicole Weiss is our Director of Community Training and Empowerment. And then Dr. Carrie Yeager, who's managing our technology integration and support, will also be presenting this morning. I'll be covering the healing division this morning. Let's go to the next slide, please. So I want to welcome you. This is going to be an annual exercise for us right around the time that we launched the Institute, which was March of 2020. So in March, around March 15th of every year, we'll be coming out with an annual update to provide information about the 3 different divisions that we have in the Institute and what the accomplishments and strategies have been over the last year and the impact that we're having both on the research and science world, on the healing, especially from trauma and adversity, and also our community impact. Next slide, please. So to launch today, what I want to do is mention first and foremost our mission for the Lyda Hill Institute for Human Resilience. And I should say that we are in debt and very thankful for the generosity of Lyda Hill Philanthropies for funding us to launch the Institute in 2020. Lyda has also been very generous and funded us before when we were the Trauma, Health, and Hazard Center back in 2014. She also funded us to launch our clinic at that point, the Veteran Health and Trauma Clinic. Without her support and the Lyda Hill Philanthropies support, we would not be here. So I do want to mention our mission, which is advancing human resilience to adversity by designing evidence-based solutions through interdisciplinary research, healing therapies, and community training and empowerment, all focused on advancing human resilience. Next slide, please. We have 3 main operational areas. And what I'm thinking is many of you maybe have not been part of our Institute so far or have not sought out information about the Institute. So I want to give you some basic background. The Institute really grew out of the Trauma, Health, and Hazard Center, which was born back in 2002. And so for 18 years, we ran a cross-disciplinary research center that added clinical services in 2014. And then in 2020, we launched the Institute, and it has 3 main divisions, as you see here: the healing operations, which include our Veteran Health and Trauma Clinic. It also will include our Milestones Resilience Care Center, which will be opening in 2022. Basic and clinical research that's cross-disciplinary. So we'll have Dr. Littleton will talk about our research operations today. And then our community training and empowerment program, which has been in operation as part of the Trauma, Health, and Hazard Center with our peer support work, but has definitely moved out from there and is doing a lot of different work in the community right now, especially since COVID. So we'll be talking about that today with Nicole Weiss. Next slide, please. It's important that an institute has its sort of anchoring, if you will, in the strategic plan from the campus, from the university. And we are currently anchored at UCCS. And happy to be here, and we are definitely integrated into the strategic plan here. And that includes, first and foremost, promoting research, in this case, and generating new knowledge that benefits society and is transformational for both society, I believe, as well as for students. As you will hear today from our research mission, we are really working hard on exactly that. Secondly, to support distinctive programs. And what we are doing here at UCCS, we are a distinctive program in terms of our focus on resilience and the management of adversity. you can tell just over the last several years, I think the focus of what we do within this institute couldn't be more timely and more appealing and appropriate for the conditions we're facing now in the world. So we also support other programming at the university, such as the clinical psychology PhD program in psychology that focuses in trauma. And it definitely has put us on the map relative to the work in resilience and trauma. The third, pursue mutually beneficial partnerships and outreach in the community. You'll see with Nicole Weiss's presentation, we are interwoven into the community in many, many different ways. And that's one of our key missions within the Institute. Next slide, please. So I wanted to bring up just a couple of things that you may not know about the Institute. You may have heard about us, but didn't know certain things. I think people think that this is a psychology institute. We're not. We're cross-disciplinary. The Institute includes faculty from every college on the campus except for the College of Business, and we definitely want to try to rope in somebody from College of Business. But we have 9 different disciplines represented from across the campus. So it definitely is a cross-campus collective effort around resilience. Next slide, please. And while many of our researchers and research affiliates are from UCCS, we also have affiliates from the Anschutz Medical Campus, and we have scholars from across the US and around the world who are connected to us. If you want to look at the different domains that all of these researchers are linked to and the different campuses and locations around the world, please visit our website for that. But we have faculty from Poland, the Netherlands, Norway, Australia, Japan. And in fact, it's important that you may have heard that we have 2 visiting scholars right now from Oslo, Norway. And they're doing some great work here with us. And we've just recently looked at doing a combined research effort around the effect of COVID on healthcare workers, both in Norway, and we also have that program research going on here in the US. Next slide, please. Number 3, many people who do know about us think that all of our clinical operations are basically at the Veteran Health and Trauma Clinic. And while mostly they are, we also have community training and resilience support that we've been doing in the community to develop out a stepwise step care model to help identify people who have trauma early in the process and get them the support they need to help prevent ongoing problems, but also get them more intensive treatment and support when appropriate. So we definitely move beyond the walls, if you will, of the Lane Center on the 3rd floor where the Veteran Health and Trauma Clinic is located. Next slide, please. Number 4, some people don't realize that we're involved in education and training. So it's important that people understand that we are actually one of the main training sites for our clinical PhD students who are focused in trauma. And we've done so since 2015. And we've had, I think, a total now of about 15 students come through our clinic. And we also recently added a social work intern, and we're very excited about that. So we are doing what we believe is essential to bring to the workforce in the Colorado Springs area new professionals who have the background and training in trauma that is so essential for providing care in that area. Next slide, please. So what I'd like to do now is turn this over to Dr. Littleton, who can talk about our research focus.
Thanks so much, Dr. Benight. So I'll be providing some updates about what's been going on in the research division, including our impact, our outreach, our grants, and then our sort of ongoing and future goals. Next slide. So Dr. Benight mentioned our Institute affiliates. If we look at the impact of the work that our Institute research faculty and affiliates are having, one metric is something called the H index. That's considered probably one of the best ways to indicate the scholarly impact of someone's work. If we look at the H index of our faculty and affiliates, 7 are in the top 10% as far as the scholarly impact of their research work. And an additional 3 researchers and affiliates are in the top 1% of the impact of their work. Another way of looking at impact is just publications. And so in the past year, Institute researchers and affiliates have published over 100 scholarly papers. Next slide. A goal of the research arm of the Institute is really to disseminate resilient science. And one way we've done that is by implementing a monthly speaker series. We've had 7 of these monthly seminars so far, and they are offered on webinar format. So they're highly accessible both to individuals at UCCS, the CU system, nationwide and internationally. These speakers have covered a range of topics, sort of broad themes of the topics that have been covered include utilizing nonlinear dynamic systems modeling to understand resilience, as well as to evaluate interventions, applying social cognitive theoretical models and looking at the role of social factors in understanding how individuals respond to trauma and develop resilience. Moving beyond a psychopathology focused model of trauma to understanding the multiple impacts of trauma that can go beyond things like post-traumatic stress disorder and depression. And finally, examining how people are able to adapt to multiple and evolving risks in their environment. Next slide. The Institute also had their first virtual symposium. And this symposium focused on global perspectives on sexual violence. It was conducted in conjunction with publication of a special issue of Psychology of Violence on the same topic. It features 7 speakers that covered a range of topics related to sexual violence from an international perspective. This included the role of country level factors, so things like laws and attitudes toward intimate partner violence and understanding how that might affect the prevalence of sexual and intimate partner violence across countries. Understanding the sexual violence experiences among individuals who held marginalized and minoritized identities, such as sexual and gender minority individuals and Middle Eastern individuals living in the United States, as well as summarizing what we know about the global prevalence of sexual violence. This symposium was very well received. We had 147 attendees representing 8 countries. So a real nice sort of indicator of the impact of that work. Next slide. Now I'm going to shift gears a little bit to talk about extramural funding that for research in the Institute. Since its founding, the Institute has secured over $4.8 million in extramural funding at the federal and state level for research specifically. Next slide. So Dr. Benight briefly talked about this first grant-funded project, the BRIGHT program, which stands for Building Resilience After Injury, a Growth and Healing Toolkit. This $1 million grant is designed to deliver resilience-focused, trauma-informed behavioral health services to patients right after they experience a physical injury, so when they're first seen in the ER and in the hospital. As he mentioned, it utilizes a stepped care model. And one thing that's novel about this intervention is first, with a stepped care model, that means the level of care is tailored to the individual's level of need for services. Is that not only is it stepped care, but it integrates technology-based services, telehealth delivered services, as well as more traditional in-person psychotherapy services. This grant also provides training to trauma psychology graduate students in how to provide this sort of resilience-focused post-acute care designed to really ensure that people develop trajectories of resilience after a significant physical injury. Next slide. The next project is one that I'm actively involved in, the PRYSHM Project, which stands for Promoting Resilient Youth with Strong Hearts and Minds. This grant is designed to develop and evaluate a teleconference delivered intimate partner violence and alcohol use prevention program tailored to meet the needs of sexual and gender minority youth. Like many prevention programs, this program is designed to equip youth with healthy relationship and alcohol refusal skills. However, what's novel about it, in addition to it being delivered via teleconference, which means we can access, provide it to youth across the country, is that it seeks to promote positive youth identity development and community connections. These are things that sexual and gender minority youth particularly need. And this is in response to the fact that more traditional alcohol use and intimate partner violence prevention programs just do not work well for sexual and gender minority youth. Next slide. This next project that represents a collaboration between computer science and the Institute is designed to develop a data sharing platform for individuals conducting mass trauma resilience focused research. So in addition to enabling data sharing, it'll ensure that this data is shared in a secure way, that individuals' privacy, right, is maintained when data sharing occurs. And that's, I think, really has a lot of potential to, right, facilitate collaborations and advancement in our understanding of how individuals respond to mass trauma events. Next slide. Another project, this was a very timely project entitled Responding to Extreme Heat in the Time of COVID. So the COVID-19 pandemic presented, of course, not only challenges related to staying safe and preventing infection with COVID-19, but also having to balance responding to other environmental hazards such as heat stress, while also trying to mitigate risk of infection. So this national 3-wave survey is designed to evaluate what are the factors that affect individuals' risk and protective behaviors related to extreme heat in the context of COVID-19. And this has a lot of implications for understanding how people are able to adapt to multiple and evolving hazards, particularly heat stress, right, which is likely to become, unfortunately, more common in response to climate change. Next slide. Another very large research project is the National Child Traumatic Stress Initiative. This project really seeks to develop and disseminate a core curriculum on child trauma so that future healthcare and mental health care providers who are working with children and adolescents are able to provide trauma-informed care. So this curriculum currently exists and it's being expanded to the undergraduate level, adding new products to enable this curriculum to be disseminated more widely, as well as training 80 new facilitators. So really disseminating this model curriculum nationwide. Next slide. I wanted to conclude to talk a little bit about, it says future, but really these are both ongoing and future goals of the Institute. And you can sort of see, some of the things that I talked about really touch on those goals. But 3 that I really wanted to highlight is equipping resilient scientists with advanced statistical modeling skills. I mentioned how some of our Institute speakers talk about nonlinear dynamic systems modeling, which can really, help us understand how people adapt and experience resilience because it's not in a linear fashion, right, over time. But as another example of how we're working towards this goal, this summer, the Institute will be providing workshops both to graduate students and to academics and how they can apply this, this type of statistical modeling to their own research. Another goal of the, not quite, there are 3. Another goal of the Institute is to develop equitable and inclusive measures of trauma and resilience, as well as interventions that are equitable and inclusive. Some of the projects we already talked about really are focused on that goal. Another example is we recently submitted a large grant to fully develop and evaluate a comprehensive measure of sexual victimization experiences and ensure that that measure is inclusive of the experiences of sexual, gender, racial, and ethnic minority individuals who may be more vulnerable to those experiences. And finally, another goal is to foster growth in the field of resilient science across disciplines. One example of some way we're working towards that goal is the Institute is in the planning stages of another symposium that will bring together the top resilient scientists from across the US, from across disciplines, to really engage in scholarly discussion and debate regarding the field of resilient science and its future. Thanks so much, and I'm going to turn it back over to Dr. Benight, who'll be talking about our healing division.
Thank you very much, Dr. Littleton. I appreciate that very, very much. So I'm going to talk now about the healing division and what we've been doing since the 2021 year. I do want to do a shout out to all of our dedicated clinicians who have worked tirelessly during the COVID experience to really be there and provide services to a host of people in need with trauma recovery issues. And without them, nothing would have been happening. So they really deserve a huge amount of credit for what we've been able to accomplish. Next slide, please. So since we opened the Institute back in 2020, we've increased our clinical services by 35%. And that's been an interesting challenge, given we had to go fully remote in 2020 as soon as the lockdown and shutdown was happening. So for a lot of different clinical services across the country, moving into a telehealth environment was something that people had talked about. Some people were doing a limited amount, but not at the level that we see now, of course. So that was something we were able to accomplish within a week. And we were still able to increase our services over time. Since opening our clinic in 2014, we've had approximately, at this point, a little over 45,000 clinical contact hours. So we really are having an impact in the community on the trauma level, and we are a primary go-to resource for the community, in particular the military veteran population, working with the VA and a host of other organizations such as Headstrong. Next slide, please. We also, as I mentioned earlier, are involved in student training, and this shows you the impact of our student training on services. So, it's important to think about the combination of not only providing an opportunity for students to learn at the top and the most current interventions that we have from the science, but in addition, these students are having an impact on the community themselves. And so you can see over time, we average right around 12 to 10% of our services are provided by students. Next slide, please. A very exciting program that was launched initially through funding through the Colorado Springs Health Foundation is the Resilient Families Academy. And the goal of this project initially and now going forward has been to try to provide families who may be struggling with trauma-related issues an educational platform that teaches them about trauma, teaches them about the cross-generational impact of trauma, and then identify individuals within those groups who may need further care. So you'll see this kind of theme in our work, where we reach out and provide resilience support and then identify individuals who need more intensive care. And what that's doing is trying to break that cycle that we see, unfortunately, in our society, with generation after generation experiencing trauma, and then it flows through the next generation. Even biologically, there's research that supports that. So we're trying to interrupt that process with these Resilient Families Academy. So we did a 5-week psychoeducational course for professionals that focused on the introduction of trauma, the impact of trauma on families, and interpersonal transmission of trauma. And then we've actually worked with 46 different families, including an entire department from the Air Force Family Resource Center. And then we're now rolling this out through our community training and empowerment division to go out into the community. For example, we're working currently with a group that provides services for homeless families, homeless mothers, single mothers, in trying to provide that type of education and support that they need. Next slide, please. Again, I mentioned before that we are currently training students. So we have 7 students currently providing individual group therapy at the VHTC. And we also have 6 students who are working within the hospital system right now through the Bright Project. So it's a nice combination of both within the university here in the Lane Center, but also out in the community in the hospital. We've also trained recently a postdoctoral fellow who came through our program and now is our technology staff director, who you'll hear from today, Dr. Carrie Yeager. Next slide, please. So the VHTC has many contacts and contracts through the community, and I just wanted to mention these just to show you the breadth of our work. So we have a ongoing contract with the Colorado Springs Police Department, where we provide trauma services for our men and women in blue who are out there serving the community. We also have a contract with the El Paso County Public Health Department, providing support, resilience training, resilience coaching, and actual therapy for individuals from the El Paso County Public Health. And it should go, we should state that all of us deserve or need to thank the Public Health Department for the hard work that they've done during the pandemic. We also provide services to UCCS faculty and staff. And I'll talk in a minute about the CREATE program. The VA is a partner with us. We've been providing services for veterans, mostly who are in acute situations where they can't get into the VA as quickly as they need. And they refer to us quite often. Headstrong, which is a philanthropy organization in the country that focuses on providing services to veterans. And we've been working with them for several years. Veterans Trauma Court, which you may or may not know about. I was involved in a grant through the CDPHE for probably 5 or 6 years ago that established the Veterans Trauma Court in the state of Colorado. And in El Paso County, we have one of the most successful trauma courts around in the country. It's been used as a model program. And basically veterans who've had a trauma background who get intertwined with the legal system, this can be a way for them to divert into actual trauma care. And at this point, we're doing assessment as well as treatment for that population. We do work with TESSA, in particular around human trafficking. We also provide support to the domestic violence staff, UC Health Memorial, and then 20 other insurance groups. So you can see that we're involved quite a bit with the community in different ways, and definitely serving the military veteran and first responder population. Next slide, please. To show you the sort of direct impact on military veterans, 33% of our clients are from the VA. The other 42% are coming through TRICARE, meaning that they are service directed or service linked in some fashion. And then 12% from Headstrong, which again is that philanthropic organization that provides funding for veterans to get care. So you can see that a large percentage of our clientele is military veteran based, and we see that as a primary mission for us in the Institute. Next slide, please. I am very excited to talk about the Milestones Resilience Care Model. So we have been talking about developing out a new system of care for trauma survivors that removes the stigma and the pathologizing that is currently the model of care across the world, actually, which basically the concept is that you have to have a diagnosed disease, if you will, with PTSD to be able to get reimbursement and receive care. And it's all done in a clinical format. And we are kind of unpacking that and turning it on its head a little bit and looking at a more holistic, multidimensional care model where people can come in and heal from trauma rather than be treated for something that is not a disorder, disease. This definitely has extreme effects. There's no doubt about that. When people are traumatized, it can have extreme effects and people can have difficulties. But the medicalized nature of the way we go about it creates a lot of challenges. So we are going to change that and provide a whole new model of care that's going to be hosted on the 4th floor of Lane Center, and it will be called Milestones Resilience Care. Technology will be interwoven with this, body care, acupuncture, massage, yoga, creative arts, music therapy, and outdoor experience therapies. So it'll be a lot of ways, if you will, pathways to healing, which we're very excited to be offering. So that should open hopefully in summer of 2022. Next slide, please. The CREATE program is something that some of you from the campus may already be aware of. This has been a very successful program thanks to Lisa Decker in particular, who's sort of spearheaded this. Also, Aaron Fowler had some contributions to this. But basically, it's the idea of cultivating resilience and empowering adaptation through expression. And there are all kinds of, we've had 125 UCCS staff and faculty come through this program already. When we open the classes, they fill immediately. So look for those in the future. We've had things from sculpting to painting to writing, creative writing, cooking. So we're real excited about this. We're actually going to be moving this also out into the community because it's been so successful. Next slide, please. So I'd like to turn the mic, if you will, over to Nicole Weiss, who's leading our Community Training and Empowerment Division.
Thank you very much, Dr. Benight. As Dr. Benight said, I am Nicole Weiss, the Director of Community Training and Empowerment, and I'm excited to discuss several of the programs we are now offering out to the community, both in El Paso County as well as state and even nationwide. Next slide, please. We have 4 different programs we are now offering into the community. That includes our peer support programs. And as Dr. Benight mentioned, we have been running peer support for over a decade, and we currently have 4 longstanding relationships. We also have trainings and workshops that we provide to different organizations, our Greater Resilience Information Toolkit program, and our trauma training program. And we are also continuously looking at different ways to expand support into our community, a lot of which has come from the COVID-19 pandemic and discovering ways that our community needs extra support. Next slide, please. So our first, again, being that peer support program. Our peer support program we find is very unique in that we identify what kind of needs are coming from the organization that is looking for peer support. And instead of doing one training with them, which is the classic peer support model, we actually do the ongoing training. So we train an initial group or cohort of peer supporters, and then we walk through the next year or longer with them. So we do continuous ongoing training. We provide 24/7, 365 support to all of the peer supporters we have trained. And we also do monthly check-ins and supervision. So again, this is a bit more of a unique peer support program than the classic model. In doing so, we have supported over 10,000 employees across the state through 4 different organizations. Our current longest standing is with the Colorado Department of Transportation. This is an organization that is very new to peer support to begin with, and they brought us in 2018 to create this program for them. And as it shows there, we are proud to say we are continuing working with them into year 4, into year 5, even once we get into June. And the next one we have been working with for several years now is Lincoln Surgery Center. This is an organization out of Denver that supports different hospitals and medical clinics throughout the Denver area. And we've been working with them since 2019. In 2020, we started working with Mount Carmel Veterans Service Center, and that is a local service center here in Colorado Springs that supports our veteran community in a wide variety of ways. So we have been able to work with them on a peer support program, not only to support their own internal employees in the classic peer support model, but also how do they support some of the veterans and military communities walking into their doors. So a little bit of that extra understanding to some of the particular needs that population. And then finally, we have started working with the UC Health Southern Region Hospital System here in Colorado Springs. We are working to implement a peer support program for their organization. And this is a very large organization here in Colorado Springs with a lot of varying needs. And so it's been a very interesting journey with them to really implement this into their culture and figure out how do we support this organization through day shifts, night shifts, 20, 30 plus departments, especially as they are experiencing extreme burnout through the COVID-19 pandemic. So we've been very proud to work with them. Next slide, please, or next bullet, please. We also have a trauma training program. This is an online program that's available through UCCS, although you do not need to be a classic UCCS student to be in this class. We launched it in 2019, and it gives a foundational education on what is trauma and what is stress, how does it impact our body, how does it impact different populations, including military and interpersonal violence, and then what kind of treatments are available. So it's a 2-part class. We have a foundations and an advanced topics. Since 2019, we've trained over 190 students in this trauma training program. And that includes first responders, veterans, military communities, healthcare workers, victims advocates, and current undergraduate and graduate students in a variety of majors. What we find unique about this program is, again, it's not specified to any specific occupation. Instead, it's a really great foundational education for anybody working within the trauma population. So these have been individuals who have experienced their own trauma perhaps, or they are working with clients or in organizations that see trauma. One of the core values of our organization is to help people identify that trauma does not belong to one exact occupation or organization. So spreading that education about how does it impact different individuals has been really helpful for a wide variety of careers. Thank you. Next slide, please. Our Greater Resilience Information Toolkit. This is a very exciting program that we launched right around as the pandemic really started sweeping the country and really the world in March 2020. We knew that we needed to find a way to support the community as they were going through quarantines and lockdowns and the unknown of the pandemic. So the Greater Resilience Information Toolkit, or GRIT, was born out of that need. What it does is it instructs anybody who's watching these videos or this training on how to reach out and make simple but very meaningful and healthy conversations and connections with people in their social network. This is a unique training as it doesn't specify that you need to be from any occupation or need to have any prior training. It's really for anybody. Since we launched the original track in 2020, we've expanded into 5 different tracks, and that includes a track specifically for the education community with Grit for Ed. And we partnered with one of our local affiliates, Carolyn Gary, to create that curriculum and also specifying within the curriculum the power behind 3 Behind Me, which is that the more we surround a student or really an individual with at least 3 helping and healthy conversations and adults in their life, the more we can pay attention to the stress and support those needs. We also launched Grit Lead in partnership a little bit with the Survive and Thrive with Exponential Impact here in Colorado Springs, as well as a local leader. And that expands the track into discussing how do you support your own community as a leader? How do you support if you're a nonprofit owner or a small business owner, and some specific resources that any of those occupations could utilize. In the fall, with funding through the Colorado Department of Public Health and Environment, we launched the Grit for Health track, and this specifically showcased how do you support healthcare workers. If you remember back in 2020, this is when the burnout from healthcare workers really started to ramp up, so we knew that this was a need, and it has continued to be a need. With this funding, we have also been able to translate this track into Spanish in order to serve some of our more Spanish-speaking community. And then finally, early last year, we partnered with the Meadows Mental Health Policy Institute and One Tribe Foundation out of Texas to create Grit Serve. And this is a track specifically designed for our military and first responder community. So again, having that same core information from the original Grit track, but including information on how do you support and have conversations with the understanding of a military or first responder background. Since we have launched Grit in March of 2020, we now have over 2,800 coaches, and that is anybody who has completed or taken the training as a coach. We have expanded into 18 countries, and we now actually are in 46 states, which is very exciting. So just 4 more states to go before we've got the entire United States with a Grit coach in the state. We're very, very excited. Part of expanding into the countries has also included adaptation into their culture. So India, Australia, Japan, and Puerto Rico are each working on initiatives to take the Grit training and adapt it to their own culture and language. So we've got some very wonderful partnerships going on within those 4 countries, and we're excited to see what kind of results come out of the Grit trainings customized to that population. Earlier this year, we received some grants from the El Paso County ARPA grant, or received some funding, excuse me, that is going to allow us to continue to expand Grit. The 3 major initiatives is to expand the curriculum into other natural disasters, knowing that as the pandemic does start to wane, we are kind of becoming more aware, or at least being able to bring more attention to some of the other significant natural disasters that are happening across the world, as well as community disasters that do tend to impact or local communities as well. We are also working on creating a Grit app called Grit E that will allow both the curriculum and resources, and as well as healthy tips and tricks, to be right there on a phone that a Grit coach can use within their conversations, and really anybody in the community can use to access the Grit training and some extra resources. And then we will be working on a Grit Summit where we are able to bring together local Grit coaches and potentially even coaches from across the country to come together to learn new skills and really just connect as a Grit coach. We are excited to say that this training really truly is for anybody. So within the training, we kind of track what kind of occupations are coming in to take this training. And as you can see on the left-hand side here, we have coaches that range from a CEO to somebody who's retired or a personal trainer, individuals working in mental health, healthcare, parents, the medical community, the military, as we mentioned as well. So a wide breadth of individuals that are taking this training in order to support the people in their community, which we are incredibly proud of. Next slide, please. And then finally, while we have a long-standing relationship with providing different trainings and workshops throughout the country, we formalized these offerings in summer of last year. Since summer of last year, we have supported 15 organizations, both locally and nationwide, in supporting their own organization. So oftentimes we are notified by an organization or a community that they've been particularly struggling with maybe perhaps burnout, or they're acknowledging that their organization experiences trauma through their client work or through some of their outreach work. And they want to be able to support their employees and support their workforce in any of those areas. So we've been able to come in and do some training on stress, trauma, burnout, and very importantly, how do you foster resilience in yourself and in your organization, and how do you create a resilient workforce? Some of those organizations have included those that support interpersonal violence recovery, those who support substance use recovery, group counseling practices, law enforcement agencies, offering parenting support, working with legal services, and then leadership departments and our own CU system. Since summer of last year, we've supported 650 employees, and that number would actually be much higher in the last 3 months as we've gone into some more organizations here locally. Next bullet. As Dr. Benight had mentioned as well, we've had significant overlap with our offerings, both from community training and empowerment and the healing division. Part of that is our longstanding relationship with Colorado Springs Police Department. So the CTE division, community training and empowerment, goes in every year and works with the CSPD Academy and CSPD CIT, which is the community intervention training class. And we provide education on stress, trauma, and post-traumatic stress disorder, so that law enforcement officers not only know how to recognize those symptoms in themselves, but importantly can support those kinds of symptoms or experiences in the calls they're going to. So they're a little bit more equipped with knowing that if a call is involving somebody who's experiencing trauma, they understand a little bit more about potential background and how they can help that individual. We also, as Dr. Benight mentioned, work with Veterans Trauma Court. CTE does the assessment for an individual who might be looking into getting into Veterans Trauma Court, and then we see those clients in our clinic as well. I did mention, excuse me, with CSPD, we also see several of their officers through their wellness program. This is a very confidential offering that CSPD has made available so that any officer can come in for therapy without concern that leadership is going to know that that's what's happening, that they are seeking out help. And then, as Dr. Benight also mentioned, the El Paso County Public Health, we've been very proud to work with them for the past almost a year now to support their workforce employees who have been experiencing extreme burnout as well with the waxing and waning pandemic, which they've been supporting since December of 2019 even. So we are coming in to offer resilience sessions. We provide resilience health coaching, and then through our clinic, we provide clinical care as well. Next slide. And now I will pass it off to Dr. Carrie Yeager to talk more about our technology advancements.
Thank you, thank you, Nicole. I'm Dr. Yeager. I'll be talking to you about how we're using technology at the Institute. And I have a background in both clinical psychology and computer science, so I'm really excited about our work in this area. Next slide, please. So our goal at the Institute is to provide innovative technology solutions across all the divisions. As mentioned by Dr. Benight, the work we do for one division benefits the other division. It's this symbiotic relationship that really makes our work more impactful. For example, in the research division, we're looking at sophisticated ways to gather and analyze data to get a more accurate picture of what resilience is and how can we enhance it. For community, we're developing a great coaching app to support training and connection amongst our coaches. And in healing, we're developing software for the new model of care that will improve our clients' experiences by presenting a more holistic approach. It's also going to increase communication and enhance some of our resilience interventions. Next slide, please. So I'm just going to talk to you briefly about some of our projects. For the healing division, we're developing a client clinician dashboard. And this is really focused on providing client-centered services. And we do this in a number of ways. So first of all, the system is used to empower our clients. We're going to use technology to get an accurate picture of their goals and track how they're progressing towards their goals and communicating this back to our clients through an easy-to-use dashboard. And with this dashboard, clients can monitor their progress, they can engage in their treatment goals, and it can increase motivation. Next bullet, please. The system is personalized and streamlined. We streamline the paperwork so we can focus on what we do best, which is caring for our clients. It's personalized in that we use assessments to get a real accurate picture of our clients' strengths and their challenges, and to use that as we develop treatment recommendations. And then we can present a friendly report to our clients about their treatment recommendations that can be reviewed with them on a regular basis by their care coordinator. Next bullet, please. And so another goal of this system is to increase communication, not only between the client and clinician as we help them move towards their goals, but also amongst our interdisciplinary team. We want to make sure that we're all working together towards the common goals of our clients. And this system can be used to make sure we're communicating throughout the milestone resilience care. Next slide, please. So another area that we're focusing technology on is enhancing and extending clinical services. So for example, we're upgrading an online intervention to be more modern and flexible to adapt to new communities. And this is going to be used by a number of our programs, including the BRIGHT program that Dr. Littleton talked about. It's going to extend our services by being available 24/7 at a reduced cost. Next bullet. We're also looking at enhancing skills training through using a number of innovative technologies such as virtual reality. And next bullet. And for those interested, we want to incorporate sensor monitoring for behavioral goals such as sleep, exercise, activity, to get a real accurate picture of how they're doing and how can we best support them. Okay, next slide, please. And the last thing I want to talk to you about is our mobile app for grit. Nicole had mentioned this, and this is called Gritty. I love that name. It's designed to support the building and maintaining of community resilience. And coaches will be able to use this in a number of ways. They can use it to introduce grit to others. They can provide information on how to become a grit coach and links to training. They can remind coaches of the essential skills they've learned, which can be used in the field as they engage with their community to have these meaningful conversations. We want to encourage our coaches via text messaging, provide local and national resources, and then finally an easy means to track their contacts. And so that's just a very brief overview of some of the work we're doing in technology. So thank you for your time.
Thank you, Dr. Yeager. I appreciate that. So we are going to move now into talking a little bit about our financial status and where we are. So we were, as I indicated before, very lucky to have a matching gift or a grant through the Lyda Hill Philanthropies of $8 million. And in that process, we've been working diligently at the university here, obviously with the advancement office here to obtain a matching funding to bring that total of $15.75 million budget into reality. So we've now achieved a good proportion of that, but we still have a remaining amount to fundraise. So if today what you've listened to is interesting to you and you're interested in helping us to achieve our mission, you can do that by going to resilience.uccs.edu/get-involved/give. So we do have a way for that to happen on our website if you wanted to join us in that process. I also want to sort of end today with an encouragement. If you have not taken the GRIT training, all you have to do is go to grit.uccs.edu and you can sign up for any of our different tracks that you want to, and they're all free. and it takes you a total of 5 hours out of your life. But given the status of our world these days and the potential for other natural disasters to occur or other unfortunate events, having this kind of background and knowledge can be extremely important for our community. And the goal is to build out as many coaches throughout our society as we can. And with that, we can have a system that can be launched and activated quickly, because we'll have a way to do that with our new Gritty app and helping to support the community in a real timely and cost-effective way that other programming that we do in our culture does not do. So we're pretty excited about that, and hope that you could join us in that if you want to go and spend 5 hours getting that training. So next slide, please. So we've got approximately 10 minutes left. We wanted to leave a little bit of time for all of you to answer questions or to ask questions. Hopefully we can answer some of them. So if you have any questions, you can use the Q&A feature at the bottom of your Zoom screen, and we can just sort of leave those open for a little bit here. If you have any questions, please type them in there and we can respond to those as quickly as possible. So, and it should be known that your question is not immediately available to everyone. It's just to the panelists and the hosts. So they're basically confidential questions initially. So any questions anybody has at this point? You can also use the chat function if that's easier for you to just indicate any kind of comments or questions you might have. Okay, so I see a couple of comments coming through the chat. Which states are missing GRIT trainers? That's a good question. So Nicole.
If I can remember off the
answer
top
that?
of my head, we have Wisconsin, Delaware, Montana. I can't think of the fourth one, but I can get back to you. But those are the big, those are three. I'll get back to you on that fourth one.
Great. We're going to get them eventually. Any other questions? Jen Ferda had indicated she's proud to be a grit coach. That's awesome. We're proud to have you as a grit coach. Joe Ruzek has a question that says, there's lots of potential for integration of the many Institute efforts. Is there a potential for creating a model of community resilience using many aspects of the Institute operations? And I'm going to just answer that quickly. I definitely think so. I think what we're trying to build is this sort of shifting of awareness to the community itself, so that right now we've been sort of lulled into this reactive response system in our society, actually across the developed world, really. And we need to shift that to be a much more empowered community base. And we have the knowledge base, we have technologies now, we have research capacity that we can evaluate these effective types of interventions that really empower the entire community. The grid is an example of that, step in that direction. And I think we need to continue to do that. So the answer is yes. I think the Institute offers all three of those pieces by doing some stepped care all the way into actual intensive support and crisis response, but also a lot more around resilience building and empowerment. So great question. Another question is, what options are available for trauma training, re financial aid, low-cost training? I think for the trauma training course, if that's the question, Nicole, do you want to field that one?
Absolutely. So it is a low-cost program. It is $250 plus university fees, which is $42. So $292 per course. And there's 2 of the 8-week courses. So the program in itself is just under $600.
Great. Thank you for answering that. And there was a question in the chat that's wondering about, are there any things that local clinicians providing therapeutic care can help support the Institute? I would love to talk to you more about that, Abby. There's probably a host of different things that we could talk about. So if you want to reach out to me specifically, and my email is simple, benight@uccs.edu. Happy to chat about that with you. And thank you for being willing to help support. That's great. Any other questions that people have? Great questions. I did want to mention, as we're getting ready to close down, just briefly, you know, sometimes what happens during major crises is opportunities, and the pandemic is no exception to that. And the GRIP program was born out of that sort of awareness that this was going to be different, that we had never experienced before. But other leaders in the community have also stepped up and provided funding and vision in ways that we haven't had before, that really is now changing things. For example, the CREATE program that we were able to put together was really based off of some vision from the previous president of CU, who put together a wellness initiative and provided funding to the campuses to help promote wellness on staff and faculty for the different campuses. And because of that, we were able to do many different activities, but one of them primarily was the CREATE program. And that's been, you know, so well received. It's clear that when we think differently sometimes around mental health and wellness and resilience, we can actually meet people where they are and get them some things that really do help them and feeling a little bit more connected, a little bit more empowered, and maybe some healing, really, with given what's happened over the last couple of years. No doubt about that. We've all gone through quite an experience. So if there aren't any other questions, I really want to thank everyone who took their time this morning to spend it with us. Look for us next year. We'll come out with another annual update, and hopefully you'll see a lot of different activities and extensions of what we've been doing all along. So thank you so much, and be well, take care, and we'll talk to you in a year. Take care. Bye-bye.